Welcome, everybody. We're so glad you could join us today. We're thrilled to have Governor Murphy hosting a conversation around the safety and importance of vaccines, specifically within our Black communities in New Jersey. We'll be getting started just momentarily. We have a large crowd coming into the town hall today. Everybody is on mute who's a guest in today's forum, and you can feel free to put any questions you have in the chat box. This is also on Facebook Live, so people can be watching it there as well. So welcome, everybody, and with a couple more minutes of letting people in, the governor will kick us off and get us started. Governor, we're ready when you are.
Deb, thank you. My late mother would remind me that you're known by the company you keep. So I want to thank Deb Kornavaca for welcoming us, and to Deb and Reverend Derek Green for helping to gather the group. But I'm honored, incredibly honored as well, to be joined by my partner in government, the one and only Lieutenant Governor Sheila Oliver, the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. He will join us in a minute. We're incredibly honored if Dr. David Kountz, the Co-Chief Academic Officer of Hackensack Meridian Health. We have my dear friend, Pastor Melvin Wilson, pastor of St. Matthew AME Church, and a guy who's been there with his First Lady at every step of the way during this pandemic. And lastly, a great union leader, another great friend, Debbie Parks, Associate Director and International Vice President of ASME NJ. It's to each of them and to all of you who are joining us, bless you and thank you. So what I'm going to do is have very few brief comments, and then I've got questions, if everyone could bear with me, that I want to direct at some of our distinguished, there's Dr. Kountz, Doctor, welcome, that I can direct at some of our distinguished participants. And then if we've got a few minutes left over at the end, we'll get Deb Kornavaca back on stage to see if there are any questions you may all have come up with from the audience. So this is not news. We know that this virus has had an outsized impact on our Black and brown communities, and in communities, by the way, with a big overlap, that have been historically under-resourced, especially as it relates to medical and healthcare. Underscoring our efforts is the need to ensure that residents trust in the safety of the vaccines. We need every resident to know that they can trust these vaccines, which are our most potent, not our only weapon, but our most potent weapon against COVID. Judy would want me to remind everybody it's still wearing face masks, social distancing, washing hands with soap and water, taking yourself off the field when you have a reason to. But the vaccines are a huge weapon at our disposal. And this reality is what is driving us, all of us, to ensure equitable access to vaccines. I would put us up against any state and how we've purpose-built an inclusive and equitable system for vaccines, but we are far from where we need to be, want to be, or will be. We have ensured that the community health centers, which already are a cornerstone of their neighborhoods, staffed by healthcare professionals who residents know and trust, by the way, play a central role in providing vaccines. We're working with our communities of faith to turn houses of worship, I hope sooner than later, maybe in a matter of days, and other gathering places into vaccination centers for local residents. I'll be at one of those locations, the community centers, tomorrow in Jersey City. We undertook these partnerships to ensure access to COVID testing, and Pastor Wilson knows that. This is, in many respects, ripping a page out of the testing playbook in the spring and applying it to the vaccine reality today. And we're going to follow that model for COVID vaccination. The broadened federal partnership with Rite Aid and CVS will, not yet, but it will expand access in areas of high need. And we're supporting efforts being undertaken by our cities and counties. We've chosen our 6 mega sites to be accessible, not just by car, but by mass transit. And we know, we hear every single day the rightful skepticism in communities of color as it relates to getting their arms around the vaccine and embracing this with the Tuskegee chapters and others in our nation's history. And by the way, if that weren't enough, it is Black History Month. And for all the above reasons, this is job number one, and I'm incredibly honored to be joined by this team. Sheila, let me start with you, if you don't mind. You've had experience, unlike I think any of us, whether it's municipal, county, federal, private sector, community organizations. From your experience and your perspective, what is the most important way that we can help Black communities feel secure about getting the COVID vaccine? And Sheila, thank you in advance for everything you do for the great state of New Jersey.
Thank you so much, Governor Murphy, and good afternoon to everyone. One of the things that I think about daily, as we know we are going to be able to broaden our ability to vaccinate people, my experience has taught me that you have to take it to the people. And even though all throughout the state, we have set up a system of mega vaccine sites, we also have faith communities that will be implementing programs throughout their churches. I think that for us to encourage people in the African American community to access the opportunity to be vaccinated, we're going to have to go to where they are, as opposed to having to come to a location. I think about our elderly population. I don't think that our elders are going to venture out to go to a mega site. I think we're going to have to do things like where there are congregate living centers, where there are senior citizen buildings. Just like we did with testing, we're going to have to go to those buildings and replicate that as well. I think about when we had to elevate the consciousness of Black men about prostate cancer and how men were reluctant in the Black community to even go get tested. I think we're going to have to maybe do some of those types of grassroots projects of going into barbershops, leaving leaflets, leaving information in hair salons and barber salons and in nail salons. I think that is the way we're going to have to get more connected up. I am seeing more and more African Americans step up and say they now want to be vaccinated. And I think the more information we all put out, the more we act as ambassadors to spread the word about the importance of vaccination. I think it is beginning to ease some of the apprehension that people had. But I'm most concerned about the most vulnerable of the vulnerable, those that aren't digitally connected in. I think we have learned that our older people are having a tremendous difficult time going onto websites and clicking, and we're going to have to figure out a better way to communicate with certain segments of the community. I do feel that the tide is turning. I do feel that I know that I get a lot of people outreaching, wanting to be vaccinated. So that's a good sign for us. I think the work that Governor Murphy and our Health Commissioner Judy Persichilli do every week with the daily briefings is going a long way to make people feel comfortable and confident. I think the fact that there has just been a long history of healthcare disparity in the Black community, that that people in the Black community haven't stood up and taken notice. We're now getting people masked up. We have them washing their hands, Judy. We also have people social distancing. I hear every day people saying, I'm not going anywhere. So the message is getting out. But I do want to say we should embrace non-traditional ways of bringing vaccine to people at the community grassroots level.
Sheila, thank you for that. That's the big, as you know, and you've been working on it and leading as much as anybody, that's the big animating reason why we're going to get to houses of worship, why places like CVS that are located in urban centers, like the Bethune Center that I'll be at in Jersey City tomorrow, could not agree more. So here's one thing that I guess we started a little over a week ago, a little over 2 weeks ago, pardon me. In addition to the website, covid19.nj.gov/vaccine, to your point, Sheila, particularly seniors, they're not going to be on a website with the same level of participation. So this probably won't be nearly the last time we shout this number out. Call center open 8 a.m. to 8 p.m., multiple languages. I think Judy has 250 people staffing it remotely. 855-568-0545. 855-568-0545. Sheila, cannot thank you enough for those comments and for everything you do in leading this state. So Judy, if I can maybe turn to you to follow on Sheila's comments. Good news, unfinished news. Good news, we've crashed through 1,100,000, I believe, vaccinations, and it goes up by the minute. You and I were at a developmental disabled location in Somerset County today, seeing some staff members get vaccinated, which was really encouraging. But we have work to do as it relates to the equity associated with getting everybody vaccinated, especially in our Black and brown communities. Can you, Judy, speak to from the DOH lens, what that looks like in the days and weeks ahead, that we can not just be on that journey, but that we can make great progress? And we cannot thank you enough, Judy, for everything you're doing.
Thank you, Governor, and thanks everyone for inviting me to speak with you today. It's a real privilege. Let's start with our overall goal. In New Jersey, we plan to vaccinate 70% of our eligible adult population within a 6-month period once we get adequate vaccine. Our objective is to prevent mortality and morbidity and to preserve societal functioning. Societal functioning is preserved by vaccinating essential workers. Black and brown communities are very prevalent in our essential workforce. And I want to say very clearly that you're at the top of the list. Let's talk about prevention of mortality and morbidity. It's young Hispanic men in New Jersey are 2.5 times more likely to die from COVID-19 than their white counterparts. Young Hispanic men. African-American Black men and women are 2 times more likely to die from COVID-19 in New Jersey than their white counterparts. So the goals of our program are first to provide equitable access so that we can achieve community protection. Some of you might use the term herd protection or herd immunity, and to build sustainable trust, not only in COVID-19, but in vaccines generally. And as the Lieutenant Governor suggested, and we totally agree at the Department of Health, the way we do that is to move closer to our most vulnerable communities, our communities in need. So we have a group here, a vulnerable population team, that is looking at how we can do that. In addition to Dr. Meg Fisher, who is our special advisor to the department and is one of our lead educators, bringing up program upon program of education and awareness to all of the populations in New Jersey, we have segmented our work into what we call special and vulnerable populations. The homebound, the elderly who cannot leave their homes, the homeless, people experiencing homeless, migrant workers, individuals in county jails and correctional institutions, all of our senior centers, in addition to all of our congregate living, long-term care, et cetera. We're working with our local health departments. We have 33 FQHCs that are currently points of dispensing, places where you can get vaccinated. We are bringing up pop-ups. The governor gave you a little taste of what that might look like later on in the week. I think Saturday, we will bring our first pop-up with the help of FEMA at a church in Franklin Township. We have identified 10 highly vulnerable cities by looking at percent poverty, percent of individuals that do not have transportation, i.e. cars, social vulnerability index as promoted by the CDC. So we have identified 10 areas After the pop-up in Franklin Township, we will be moving on to Patterson. And we will have a pop-up in Patterson to vaccinate individuals where they are, mostly around their churches, which are so important, such an important gathering place. And we will go through all of the 10 cities that we've identified. We will bring up a community core of individuals who will go into our vulnerable cities and educate, answer questions, register, and help people get access to vaccinating sites, to places of administration. That community core will give 2 first messages: no out-of-pocket expense for vaccines, and no documentation that will be sent to an immigration. So part of that education is beginning. And once we have adequate vaccine, I know we will reach our goal of vaccinating 70% of the adult eligible population with a fair and equitable outcome. I'll turn it back over to you, Governor.
Judy, thank you. And you make a point I probably should have made right at the very beginning. We're having this conversation in the context of an enormous supply-demand imbalance. Going back to the last federal administration, and Judy was with me on all these calls, to put it politely, we were overpromised and underdelivered. The Biden team is all over this, and I think making great strides, but it will take time. And importantly, these vaccines, not only are they free, but the first 2 are highly, not only safe, but they do the trick. But they're two doses, they're 2 shots, which makes the distribution reality a lot more complicated. Johnson & Johnson, an iconic New Jersey firm, has signed up to get an emergency use authorization, which they're going to pursue in a couple of weeks or within a couple of weeks. That's a 1-shot vaccine, regular refrigeration. God willing, that gets approved. That could be a game changer on top of what we have. But right now, I'm seeing a lot of comments. Hey, I can't get through on the phone. And we have enormous sympathy for that. Judy's adding more folks to answer the phones rather. And I think if we have some amount of patience in here, this will correct itself. I hope, and I think Judy would join me sooner than later.
Judy, Governor, if I may, I do have some late breaking news. The federal government just announced that they will be shipping doses from their federal allocation directly to FQHCs. And we have over 30 FQHCs in New Jersey right now that are all signed on, that are points of dispensing and are ready to go. So that's really good news for us.
That's huge news. Sheila, you were agreeing. I think that's big news, right?
Absolutely, yes.
And by the way, they are overwhelmingly in the communities that we're talking about, Black and brown communities in our state.
Yeah.
That's great news. Judy, is that starting immediately?
My understanding is next week.
Fantastic.
It just came through.
Hot off the press.
Hot off the press.
All right. Thank you for everything. I wonder if I could turn to Dr. Kountz. And Doc, thank you so much for being on with us today. You're a big deal leader in our state. And even in peacetime, when we're not fighting a pandemic, the work that you do as the co-chief academic officer at Hackensack Meridian Health makes a huge difference. I mentioned this in my earlier comments. There is, and I'm preaching to the choir here. You all have forgotten more about this than I know. There is, to say there's justifiable historic mistrust of vaccine safety in the Black community is an understanding. And it does feel like, putting aside the supply-demand imbalance, we do have a fair number of folks out there that are taking sort of a wait-and-see attitude to see whether or not this thing, in fact, is what we say it is, which is that it's safe, that it works. It's why getting role models vaccinated. Sheila, it's why I love seeing you get vaccinated last week, right? So the folks that people look up to, that's part of the driving reason why we've tried to do that. But Doc, any advice you've got on that front and what we can be doing to push back on that rightful skepticism? I can't thank you enough for being with us.
Well, Governor, thank you for the opportunity to join you. It's really an honor. I practiced in Monmouth County for about 15 years, and it was, I had the advantage of knowing a lot of our church leaders when this first started. So I began speaking with community leaders, church leaders. And I think one of the key points in my experience is that we need multiple touch points. We're not going to overcome, for some people, a lifetime of concern, anxiety, distrust, often in a single meeting, a single telephone call. It may take a celebrity. It may take a loved one coming back and saying, I got the vaccine and I feel great. It may take that trusted pastor. So I think we have to understand that it's layers of conversation. Very recently, I was speaking with one of our employees or team members at Jersey Shore University Medical Center. We had 3 conversations over a period of 2 weeks, and I told him, call me at any time, day or night. We actually didn't know each other. He saw me from doing some speaking around the hospital. And he finally said, you know, from thinking about what you said and thinking about my family and wanting to see my mother, I'm going to get the vaccine. So I think we have to realize how deep some issues around distrust are, to not fool ourselves. And the efforts that the state is putting in terms of public service announcements, I think is really important, but also that face-to-face connection, perhaps multiple times, is going to really do the trick. The other thing, and I'll stop after this, is of course, getting more vaccine. I think some of the mistrust is converting into, I just want someone I know to get the vaccine. And when that person comes back in the household, comes back to the church, comes back to the community center with that button on their, that sticker on their lapel, that's going to make a big difference as well.
Doc, to that last point, Deb Cordovaca and I, Deputy Chief of Staff, had a conversation with one of the leaders of the big nursing healthcare unions, and this was probably 10 days ago. She said the take-up rate had gone up dramatically since mid-December, for the simple reason that, and particularly, by the way, there's been a lot of myths out there. Judy knows this better than I do, as you would know, Doc, that this could impact your DNA, or it could impact women of a childbearing age, which there's no evidence of that, right? So I know Judy wanted me to say you should speak to your healthcare provider if you are pregnant before you take it. But the point was, is they saw colleagues take the vaccine and then get the booster shot, and literally nothing happened to them. Their confidence went up meaningfully. Is that your sense of the case? Forget about healthcare workers in the Black and brown community.
Absolutely. You know, I spend some time at our hospital as the observer. So I'll wait with our individuals coming through who get the vaccine, and they wait and sit with us for 15 minutes. And I go over and give them a sticker and say, make sure you show proudly when you get home the sticker. And it doesn't matter if they're Black or brown or white or in a wheelchair, or they convey that sense of confidence to their loved ones. And that's one of those layers of touch points for someone to step back and say, maybe this is safe. I'm going to go ahead and get this done. So yes, that has been my experience.
You mentioned, Doc, thank you for everything. And by the way, I'm a Monmouth County guy, so we're in the same neighborhood. You mentioned trusted pastors. New Jersey is blessed with many, and trusted faith leaders across the whole spectrum. But I know of no one who's not only incredible at his day job in the pulpit and in the community generally, but who has embraced the leadership responsibility during this pandemic, like Reverend and Pastor Melvin Wilson. Pastor, great to have you with us, and please give the First Lady my very best.
Thank you, Governor.
I mean, I guess the question I should ask you is the obvious one. We think faith leaders can be game changers here in terms of vaccine confidence and vaccine distribution. We assume you're in violent agreement, but please chime in.
Thank you, Governor Murphy, Lieutenant Governor Oliver, other panelists. Of course, all of you have already said everything I was going to say, so that cuts my right down half. But absolutely, faith leaders of all faiths, not just the church, but mosques, synagogues, other houses of worship, are really the key to making this happen in our communities. As you know, Governor, you authorized and supported St. Matthew being really the first church in the state to offer testing, COVID-19 testing. And I've actually had a little bit of an argument that we should still push testing at the same time as we're administering the vaccine, because people still have to be tested. We are doing testing and have been doing testing the last several months at St. Matthew, certainly have tested upwards of 10,000 people since the beginning of this thing. And we do believe, and you were talking about seniors, the importance of seniors. We have 4 senior residences right on our block. So if we could have the seniors, walk a half a block down to the church to be tested, since we're not in the church worshiping on a regular basis, that doesn't mean that the church is not open and functioning for ministry in the community. So many of our houses of faith, of all denominations and faiths, have space that can be repurposed for vaccines. But I also want to push back a little bit on this notion of complete vaccine hesitancy. I happen to have done a survey of my congregation and asked the question, if we got the vaccine here at St. Matthew, would you take it? And 85% of the congregation said they would. So there are some of us who are willing to step out there. We're familiar and still have sensitivity to Tuskegee and Lax and all of those other, and there are numerous, don't get it twisted, Tuskegee is not the only one. There were numerous studies where African American and Black and brown people were used as specimens, if you will. So don't everybody keeps talking about Tuskegee, but there's a whole list of them from the prison population on down. But if we can put vaccination centers quickly into houses of faith, I think we will quicker touch people in the community than going to CVS and Walgreens, because everybody's not going to go to CVS and Walgreens either. The final thing I'll say, Governor, is I think we also have to be sensitive to the perception of even the vaccines that are being rolled out now. If persons of color are not being able to get through on the telephone, if they can't make an appointment, and the vision is that persons who are non-people of color are getting in line, the perception is that here we go again. Black and brown people don't have access to the vaccines. We still have a major digital divide. Maybe some of our houses of faith can even set up our computers. But if we can't get through to the site, if we can't get through to places to make the appointments for our seniors, and our seniors, many of them are not going to go to CVS and Rite Aid and the other. But if I call them up, as I did a few weeks ago, I took one of my 85-year-old members to get her shot. And unfortunately, that particular day, we had to go way out to Livingston Mall to do it. And I'm saying, well, who's going to come out here to get a site? We need to put them in places where people have access to them, and houses of faith of all denominations. Don't skip that, of all denominations. There are many of us, many faith leaders across denominations who would be welcoming and open to utilizing our space. I don't think it's right for houses of faith to stand up the cost of all of this. We may not have the infrastructure, we may not have the personnel, but if we can partner with the state and partner with other entities to bring people in, we can move these shots as long as the supply is available.
Well said, Pastor. And by the way, I don't think it's an either or. I think it's and both. And we will get to houses of worship, and you won't be on your own. We're going to do this in partnership. My hope is, I don't know that it will be in every location, but FEMA is going to play an important role here. And as Judy said, the direct ship from the feds to the federally health qualified centers is another great step in the right direction. And I want to also, mea culpa, I use the word Tuskegee as a sort of a category as opposed to the only experience. The experiences have been sadly many. But your point is right on the money. Let's bring the supply to the point of attack where people live, the communities in which they live, to the habits which are their natural habits, like worshiping, and let's deliver the goods at that point. And that is our absolute objective, as you have done so well with testing. And by the way, Judy, I am not at all not one speck of me is opposed to both vaccine and testing in the same location. I hope you're okay with that. You're all right with that? Judy's giving me the thumbs up. So, Pastor, we're with you on that one. I don't want to cross any wires, Pastor, you can imagine. Thank you. Both Sheila and Judy mentioned essential workers and frontline workers. We had a great conversation, Debbie, I don't know, a week or two ago with the leadership team at AFSCME. And there's no organization, I think, that represents the front line as completely up and down our state as AFSCME. And as I mentioned, Debbie is Associate Director and International Vice President of AFSCME, New Jersey. Debbie, what are you seeing out there generally, but also specific to the vaccines? What are you hearing from your members? And what advice, other than getting them up to bat, which obviously is our enormous, you and I talked privately a week or so ago, that's our intention, Judy's intention, to get there as fast as we can. But what else are you hearing, and what other advice do you have for us? And bless you, and great to be with you.
Thank you, Governor, Lieutenant Governor Oliver, and to my esteemed guests. The approach AFSCME took as a labor union, because we represent DPWs, our state hospital workers, nurses, school employees, we assessed the situation and we felt that, number one, transparency and education were the keys. Transparency in, yes, acknowledging that the African American community were used as test subjects throughout the years. We can't run from that. We had to own it. And then we started educating our members. We had trainings with professionals, telling them about the COVID. We had trainings or Zoom meetings explaining the vaccines. In fact, our president of AFSCME New Jersey, Ron McMullen, is a state employee with Ann Klein Forensic Center. He is a star of one of the state videos to encourage our members to get the vaccine. Myself, as well as our director, Steve Tully, has gone on record as soon as we can, we will be getting the vaccines. The message that we're sending to our folk, yes, the experiments happened, but this is not that. We have to come together, and because our employees are working in these exposed jobs, if you will, hospitals, DPW, it is just very important that we be part of the solution. That is the message that we're sending out to our members. We can't have half the population in New Jersey vaccinated and the other half not, and we get back to normal. There will be no normal, no back to schools, restaurants, even for the workplace, no more A and B schedules until, as Dr. Persichilli said, we get 70% of New Jersey vaccinated. So that is the message that we're sending to our members, and it is going a long way. As Dr. Kountz indicated, when they see me get vaccinated as a 60-year-old African-American woman, that will encourage the next 60-year-old or 50-year-old to get vaccinated. And the last point I'd like to make, if you don't do it, check with your medical professionals. But if you don't do it for yourself, do it for your family, your friends, your co-workers, so that we all can get back to normal. So that's kind of been our approach with labor, Governor.
Debbie, really well laid out, especially that last point. If it's not for you, do it for your family or your neighbors or your coworkers. I also didn't give enough, I didn't lift up something Pastor Wilson said, that has also been weighing on our mind. It's not just the substance, the actual fact of what we're doing, how we're penetrating communities, but it's the perception. And I don't think it's all associated with the digital divide or the locations of places to go, but it does have a lot to do with both of those, which is why having a phone number where somebody's answering it, which is why having distribution in the communities are both incredibly important, not just for the substance, but also for the perception that we care about everybody, not just some. And thank God we do. Deb, we have 5 minutes. Is everybody okay to hang in for a couple more minutes, just for any buzz around questions that our viewers, participants may have thrown open? Deb, please.
Sure, Governor, thank you. I think one of the questions we saw a lot was just wanting to know, this vaccine feels like it came to market very fast. And so people are really asking a lot of questions. How do we know it's safe? And how do we know it's really going to protect us? So Dr. Kountz, I don't know if that's a question, or Commissioner Persichilli, but a lot of people just feel like, was this a rush job? Should I trust it yet? Maybe I'll wait and see.
So I'm happy to start out answering that question. The amount of worldwide study of this vaccine is really unprecedented. It literally, so many laboratories around the world focused their energy, stopped what they were doing, and had their best scientists working on this. So this was not a single pharmaceutical company out of many. This was a worldwide effort, and it really is an achievement. And I think those of us who have had the opportunity to read the way the studies were conducted, and of course here at Hackensack Meridian, we were part of the Moderna trial. We're also part of the Janssen trial. So we have a lot of direct knowledge of how this study was developed, how the vaccines were manufactured. It's a true achievement, and we're very confident in the safety of the process.
Judy, I don't want to put words in your mouth, but I think back to last summer, maybe even through Labor Day, you and I were on our weekly calls with the White House. It got a little bit, at one point in time, feeling a little bit too political for your taste and mine. I didn't feel that way at all since. I felt like this is the real deal, and I'm the least qualified person to say that. Dr. Kountz has been up against, he's been dealing with this. But Judy, any comments you want to have? The development, I think it's fair to say, is real.
The rigor that was put into the development of these vaccines is something, like Dr. Kountz said, is unprecedented. And I do want to I want everyone to know that we have a professional advisory committee here at the department that has been meeting twice a week since March. Dr. Kountz is a faithful participant. And the professional advisory committee is primarily, in the majority, from physicians from throughout the state, from communities of color. They're the people that are taking care of you. And they're the ones that are guiding a lot of our decisions as we go forward. And I think it's really important for everyone on this call to know that we have turned to the experts within our state, but not just any experts, the experts that are out in the field taking care of each and every one of you. Go on our website, you can look for our vaccine plan, and go to the professional advisory committee and look for your physicians, because they have been dedicated to helping us understand the development of the vaccines, the rigor that's put into it, how we can trust the vaccines, and how we should bring the vaccines forward. In fact, last night we were on a call, Dr. Kountz, I believe, was on till from 6 to 7:30. I mean, this group of physicians, and it was all on equity and how we bring vaccines to all of you. So I just wanted to make sure that everyone on the call knows who's helping us with these decisions.
Hey, amen to that. Deb, I'm going to interrupt. I'm going to jump the queue here, so don't be mad at me. Sheila, I'd love to give you the last word if I can ask this. I assume this direct ship that Judy announced a short while ago from the feds to the federally qualified healthcare centers in these communities, that's a big step in the right direction. You put that alongside Pastor Wilson's point about distribution in houses of worship. You then add the drugstore chains to that. I mean, at a certain point, then you get a tipping point. Is that fair to say?
Yes, I'm very excited about the FQHCs being able to get direct acquisition. The FQHCs are the health provider of choice for many people in our urban communities, and that's because it's a one-stop shop. You can go to an FQHC for prenatal care. You can go there to see a dentist. You can go there for primary care. Every medical challenge that you could potentially have, you go to the FQHC, particularly because for those that are underinsured or uninsured, everyone in the community knows that's a place you can go and you can get treatment. The professionals that work there, many of them maintain private practices in the communities in which they're located, and everyone knows them. They're very engaged with the communities. As Judith pointed out, we have 33 FQHCs in New Jersey. I'm very proud that we as state government, a long time ago, began to develop relationships and provide funding to FQHCs to better serve underserved communities. So you think about all of our densely populated areas in the state, our rural areas in the state, are hard to get to areas of the state. There is a federally qualified healthcare center there. Many people have familiarity with them. And this is definitely, as you said, Governor, going to be a game changer.
Amen. I'm seeing a number of chat questions coming up. We promised 45 minutes to our guests, so we have to close down, but I do want to make two observations. Someone said, who's on this committee? And is there any representation from the Black and Brown community? It's majority Black and Brown representation. And Judy, is there a place people can go to find who's on the committee?
If they go on our website and go to the vaccine plan, the professional advisory committee, all the members are listed. And you will see physicians that all very well known from your communities on the committee.
You betcha.
Governor,
Please, Pastor.
I just wanted to mention one quick thing. Number one, I do think those of us who are in positions of administration and authority need to have maybe a higher level of sensitivity than normal. The average person in the community has no idea how a vaccine is created on a good day. They don't know what the process is. So one of the reasons people are hypersensitive is that this whole process has felt rushed. So if you don't know from the get-go how a vaccine or how long it normally takes, you're going to feel some kind of way about this one. And I just would call on all of us to have a little bit more sensitivity, to not just say to Black and Brown people, oh, just take it. No, it's not just, oh, just take it. There's a little bit more to our history than that. So I think the level of sensitivity for those of us who are explaining this process to our people and to our family and friends would be much more helpful. I also think we have to make sure we have a clear plan to get to people who don't come to houses of faith. What about the homeless? What about those who don't have permanent residency? What about those who are just not going to go into institutions at all? There's a lot of things on the table that we do need to consider. Thank you.
100%. I got asked, Pastor, just as you were weighing in, because I saw one of the points come up very consistent with what you just said. Will we answer the questions in the chat room? Deb, I think the answer to that is yes. Bear with us. We almost always do, but it may take us a little while because they're coming at us 10 a second here. And Pastor, your point on the sensitivity, I love our team, and maybe me personally, to follow up and translate that into exactly what does that mean in terms of how we sort of frame this. I think is sort of what you're saying, and don't assume people are going to get there just because someone snaps their fingers and says it's okay. I think, Sheila, with that, we're gonna take a break. I think we should do this from time to time. If someone said, hey, in Bergen County, we're only X% in Black and Brown communities, let there be no doubt, nobody is declaring victory on this call. No one. We have a long way to go. And a big reason why we're doing this call is to find ways to get there as fast as we can. So I personally think, Deb, you've been extraordinarily helpful setting this up. I think this is something we should do on a regular basis. This is not going to be forever, but over the next weeks and months, this is going to remain with us as an important item. Dr. Meg Fisher was referred to. I want to thank Dr. Fisher for being on, Deb Cornavaca, Derek Green for helping us pull this together. And again, Lieutenant Governor Sheila Oliver, bless you. Commissioner of Health, Department of Health, Judy Persichilli, Dr. David Kountz, thank you. Doc, Pastor Wilson, to you and the First Lady, thank you for everything you do. Debbie Parks, bless you for your leadership. To each and every one of you out there, God bless you. Let's keep these things, let's keep the lines open. Slowly but surely, we get to that better place that we're all desperate and hoping to get to as soon as we can. God bless you all.
Thank you. Thanks, everyone.
Thank you.